An estimated 60 to 100,000 Americans die from deep vein thrombosis that turn into pulmonary embolisms every year. 10 to 30% die within 1 month of diagnosis. The first symptom of a PE is sudden death in 25% of patients with undiagnosed DVTs. This is why DVT and pulmonary embolism screening is so important. When there is damage to the endothelium, which is the inner lining of blood vessels, there is a clot that forms. This happens all the time without incident, but sometimes there's a disruption in this pathway where the clot is not broken down and it adheres to the vessel wall. At this point, this clot is called a thrombus. Genetic, natural, or pathological conditions may inhibit or alter the clotting cascade, allowing these thrombuses to form. Over time, this blood clot then dislodges from the vessel walls and travels in the vasculature to the right side of the heart. Once this blood clot dislodges from the wall, it's called an embolus. Blood clots are not as smooth and flexible as red blood cells, so as it travels through the vasculature, it may cause more damage to the endothelium, starting the clotting cascade all over again. Sometimes it causes damage to the endothelium that are in the pulmonary artery, causing a massive accumulation of clot, which may lead to the most deadly pulmonary embolism of all, called a saddle pulmonary embolism. As the blood is flowing through the vessels to the heart as it normally would, it's impeded by blood clots that are blocking its terminal destination in the capillaries of the lungs, where blood usually goes to get oxygenated. During this process, patients may experience symptoms of the unilateral leg swelling. They may also experience progressive shortness of breath. And those with conditions such as asthma may think that it's just an asthma attack when it's something much, much more. As the blood clot travels into the lungs, it may get broken up into smaller clots and lodge into the small terminal branches of the pulmonary artery. These clots will impede normal oxygen exchange in the lungs, so the lung tries to compensate by increasing the pressure to overcome this resistance. Concurrently, the right side of the heart attempts to pump harder to overcome the increased pressure in the lungs. Imagine trying to blow air into a stiff balloon. This can lead to what is called right ventricular dilation or right ventricular strain, which we can observe on an echo, which is an ultrasound of the heart. If left untreated, the right side of the heart will become dilated and cannot squeeze effectively, leading to tricuspid regurgitation. The tricuspid valve separates the right sides of the heart, and this valve is very important to normal cardiac function. As stated earlier, the body tries to compensate by increasing the pressure in the pulmonary arteries. This can go on for about 12 to 48 hours. Then the pressure will abruptly drop, leading to cardiac arrest. Risk factors include obesity, pregnancy, sitting or laying down for extended periods of time, smoking, oral contraceptive pills, injury or surgery, age, a family history of blood clots, or chronic inflammatory diseases. COVID-19 has been linked to increasing one's risk of getting blood clots in your legs and ultimately pulmonary embolisms. So if you are experiencing shortness of breath and chest pain with the known COVID-19 infection, or even if you have a suspicion that you do have COVID-19, please proceed to your nearest ER to be evaluated by a physician. Thanks for listening to another episode of All About the Medicine with Dr. Nola Knows.